השותף שלי למחלקה הישראלית, מוטי כרגע מארגן למטה את כל הדברים. ואנחנו המחלקה הישראלית של מרפאת ORM, Reproductive Medicine, שנמצאת בפורטלנד, ארצות הברית. אני לפני חודש חזרתי משם עם תאומות. זה דוקטור הסלה, שתכף יציג את עצמו, יציג לכם קצת על המרפאה. אני רק אגיד בשתי מילים שמי שרוצה פגישות אישיות למחר לקבוע, יש את רואים מאחורה עם הרשימות, ונשמח לקבוע לכם.
Thank you very much for coming to my talk today. It's really been a great joy for me to be in Israel for the past 6 days, to see old friends and to make new friends and see a lot of babies that have been born as a result of fertility treatments at our clinic. We've been helping men have children here in this country for several years now, and it's an important part of our mission at our clinic to help men throughout the world have children through fertility treatments involving an egg donor and a surrogate. So what I'd like to do over the next few minutes is give you some ideas in terms of ways to approach your journey in having a child in the United States, give you some tips that hopefully will be helpful to you as you make decisions regarding what path you want to take in the process. The slides are in Hebrew, but unfortunately I don't speak Hebrew, so I'm going to be looking at my paper here. Anyway, why don't you can go ahead and switch to the next slide. Our fertility clinic treats many patients. We do about 1,200 IVF treatments each year. So we're a relatively large clinic for the United States. There are 5 physicians. Dr. Bankowski and I are the senior doctors in our group, and we're the 2 doctors who help Israelis with their treatments. But we also have a team of 6 embryologists, 2 genetic counselors, and 23 staff who help our patients through the process. The staff work with intended fathers as well as with their egg donors and their surrogates. This has been a process that we've done for many, many years. We know the problems that can arise during the treatments, and we anticipate the problems and prevent them from happening. We have a wonderful team here with Erez and Madi in Israel who can also help you during your journey. So we have a unified approach to help you. We're always available to talk to you by Skype, by telephone, and by email. One of the most exciting things that hopefully you already know is that of all the treatments that we do, the treatments involving an egg donor and a surrogate have the very highest chance of success. So you should have every reason to be optimistic. There's no reason why you can't be fathers through the help of fertility clinics in the United States. We do carefully screen all of our egg donors and our surrogates to make sure that they are of optimal health, to make sure that you have the best chance of having a healthy baby or healthy twins. We are always at the forefront of new advances in fertility treatments. We were one of the first clinics in the United States to begin doing testing directly of the embryos to check the chromosomes of the embryos to make sure that they're healthy. And we're finding that this is quite reassuring to many patients, knowing that the embryo that we're selecting to put into the surrogate's uterus is chromosomally normal. What surprises a lot of people is that about 1 out of 4 embryos that grow in the laboratory have the wrong number of chromosomes. So if we do extra testing of the embryos before we put them in, it does lower the risk, a very small risk, that you could conceive a pregnancy that has the wrong number of chromosomes, a pregnancy like a Down syndrome pregnancy, trisomy 21. So because of our advanced technology, we can offer you any service that you potentially could need. We have our own egg donor program where we recruit egg donors and screen egg donors. We also work with many agencies throughout the United States who can supply special egg donors or surrogates for you. And we're here to help you through each step along the process. We want you to have the family that you want. To me, it's really not about the money. It's about helping people. And that's why I became a doctor. It wasn't to be rich. I'm so honored to be able to help people. It's really been a passion of my life. I've devoted my life to helping people having children. And it's been very exciting for me, the whole process, because I've been doing these fertility treatments now for 28 years. And people now are very, very successful with their journeys. We're doing things now that no one would have dreamed of 10 or 15 years ago. The success rates are so high and your chance of success is so good. But most importantly, we are your advocates, so we're here to help you when any issues or problems or questions may arise. Many Americans, as well as many people from other countries, feel that a doctor is a doctor, a clinic is a clinic. That's not really the case. All clinics are not the same. All American clinics are required to submit data to the US government in terms of the outcomes of their fertility treatments. And the government has required this now for over 20 years. And the information that we submit is present on websites that you can view on the internet. And the most common website people use is one that I'll mention to you in just a second. But you can compare the results from one clinic to the next by looking on the internet. All embryo labs are not the same. Our lab was specifically designed with the help of clean room engineers. In Oregon, one of the major companies is the computer company Intel. And Intel requires a very clean laboratory or fabrication plant to make their computer wafers. It has to have a special air filtration system. Very, very pure environment for Intel. The same people who designed the Intel fabrication plants also designed our laboratory. So our laboratory provides an excellent environment to grow embryos. Any kind of chemical pollution or dust particle can have a bad effect on embryo growth. Because our laboratory has such a good environment, we have very stable pregnancy rates. And we have had these very high pregnancy rates for over 15 years now. The website I was referring to earlier is called SART. And if you look at this website, you can click on different states of the United States and look at different fertility clinics. So if you're comparing a clinic in the east coast of the United States with the west coast of the United States, you can find individual clinics and see what their pregnancy rates are if you look at the egg donor section. So it breaks it down based on pregnancy rates, based on whether the person is using an egg donor or it's an infertile woman using her own eggs. So this is how Americans will look at different fertility clinics and decide which clinic to go to. This is what my patients do in Portland, because there are 2 other IVF programs in Portland. It's something that you can do as well to compare one clinic to the next, to make sure that the clinic that you're picking has one that has a verified high pregnancy rate. Everyone who you talk to today is going to tell you that they have the best rate. You're here, everyone wants to help you, but if you look on this website, you can get more specific information that has been verified by the US government. And so it's a way of finding a clinic. Also, programs like this, Men Having Babies, is an avenue for you to learn more about fertility treatments in the United States as well as in other countries. So through these different methods, you can learn more about fertility programs and how they work and how they're the same and how they may be different. These are our results through egg donation and surrogacy, whether we place one embryo into the woman's uterus or 2 embryos. Here in Israel, it's very common, very desired to have twins. I have a lot of patients from France, and it's interesting because in France it's just the opposite. Most French men just want to have one baby. So for French patients of mine, we usually only transfer one embryo. But for Israelis, we usually transfer two. And when we transfer two, the success rate is 91%. That's true whether we use a fresh embryo that we haven't done any biopsy or chromosome testing on, or whether we're using frozen embryos. And the twin rate, as you can see, is very high. About 3/4 of the pregnancies are twins, which can be wonderful because it's a way of having children instantaneously. But one of the concerns about twins is that there are higher complications during the pregnancy. So a surrogate who's pregnant with twins has a greater chance of having health problems, and she also has a greater chance of delivering early. So as we screen surrogates for future fathers who want twins, we have to be especially careful in terms of making sure that that woman has had a completely healthy past pregnancies, so that she will not have problems with her future twin pregnancy, because most surrogates who've had babies in the past have only carried one baby, because usually women, when they get pregnant, only get pregnant with one baby. It's only through fertility treatments that usually women will carry twins. There is a small chance that an embryo can divide into two. So that's why about one patient in this group had identical twins, and we have had a case where we put in two embryos into a surrogate's uterus and she became pregnant with triplets. So it is possible.
We have 2 more minutes to this round, okay?
Thank you. If that does occur, then they have to consider undergoing a selective abortion procedure. But twins are very common. This was actually taken from a French documentary. One of my patients a couple I was working with was being filmed for a French documentary that was on French TV two months ago. This is from the documentary. These are results from Israel. We've worked with 92 couples or individual men so far. And as you can see, we've had lots of babies. So we've worked with Israelis now for many years. My partner, Dr. Mankowski, comes here very regularly to see patients, and this has been my first visit to this country. So what we recommend in terms of the process is that you considering looking for an egg donor early in the process, and you can be looking for an egg donor through our clinic while your surrogacy agency is looking for your surrogate. Usually it takes longer to find a surrogate than it does to find an egg donor. We do have our own egg donor program where the donors have been already screened. You come to the United States, we ask you to freeze your sperm sample, so we use frozen sperm for the treatment process. And then we'll treat the egg donor, we'll collect her eggs. This is an example of an egg. Usually the number of eggs that we collect is between 20 and 30. And then we'll inject the sperm into the egg with a glass needle. And we'll see if the egg fertilizes. About 70% of the eggs that are injected will fertilize. And then we'll let the embryos grow.
This one is over, okay? Now it's the next one.
Okay.
אם באמת תרצו לשמוע עוד, אנחנו דוקטור אסלה פה מחר, אפשר להירשם כבר עכשיו אצל רועי מאחורה, ונוכל לפרט פחות לחץ, תוכלו לשאול עוד שאלות, אם יש משהו